We have Dr. Sandra Cabot MD with us today, and we're going to be talking about overactive thyroid, which is a very common problem, not as common as hypothyroidism. Dr. Cabot, let's talk about this.
Yeah, it's a fascinating subject, overactive, and as you said, it's not nearly as common as underactive. So we call overactive hyper, and we call underactive hypo. So I find hyper or overactive thyroid very intriguing because it's often not handled very well by the medical profession. I've never been impressed by the way doctors perceive that an overactive thyroid is something that's never going to be able to be cured. And I've always thought, well, that's a very negative approach.
Yes.
Because I think it can be cured with holistic medicine, once again.
Sure.
Yeah, so, I've had a lot of patients over the years with overactive thyroid that I have been able to cure without having to resort to radiation, which what we call ablation of the thyroid by giving radioactive iodine,
Right.
or without having to resort to surgical removal of the gland.
Yes.
Because I see those things as a last resort. I would rather treat the cause, and then the gland can recover by itself.
Let's talk about some of the classic signs and symptoms of an overactive thyroid.
Yeah, that's very interesting. Well, the thyroid hormone stimulates your cells to produce energy. So, overactive thyroid gland is producing too much thyroid hormone. So basically your cells are producing too much energy, if there can be such a thing,
Correct.
Because we always think, wow, we can't have enough energy in our lives.
Yes.
But if you're producing huge amounts of thyroid hormone, your cells will be hyperstimulated and everything starts to happen too quickly. So everything speeds up. Your metabolism speeds up, so you lose weight. Majority of people lose weight. So, some people think that's great. But you can lose a lot of weight, right? And you can get too thin. Your pulse rate will speed up, so you can develop a very fast heartbeat. And indeed, if it goes on for too long, you may develop atrial fibrillation, where the heartbeat becomes very irregular as well as very fast.
Yes.
The other thing, you may develop a tremor. So if you get the patient to hold their hands out, they'll have a bit of a tremor. Their muscles will become weak because they're hyperstimulated. They may have diarrhea. They won't be able to sleep because their nervous system is always stimulated. They'll feel extremely fatigued, even though they're overproducing thyroid hormone, because their cells can never rest.
Yes.
So, it's a syndrome where everything speeds up too much. And it can be quite dangerous if it goes on for too long, because your heart will become very stressed and you could develop heart failure.
Yes, absolutely. So for those people that think that they may have a problem with overactive thyroid, they need to call their doctor. And most doctors are not very familiar with how to treat or even diagnose hyperthyroidism. What's your
Really?
comment?
Yeah. Well, it's easy to diagnose because you'll find that the thyroid hormone levels in the blood will be too high and the TSH will be way low because it'll be suppressed. So most doctors can diagnose it. They may refer then to an endocrinologist or a hormone specialist to treat it. And the way we first treat it is with drugs, and we need to initially because, the patient is quite sick. So we give a drug that stops the thyroid gland from making thyroid hormone.
Okay.
And that's called Neomercazole, or there's another drug called PTU. So there's two different drugs we can use. The most popular one is Neomercazole, and it works very well. So it stops the huge amounts of thyroid hormone being produced. And generally, the conventional treatment is that you'll stay on the Neomercazole or the PTU for about a year, and then we'll try and slowly get you off that drug, slowly reduce it, and the doctor will go, okay, fingers crossed the disease won't come back.
Okay.
But if you don't treat the cause, the disease will often come back. So then the doctor puts the patient on another course of the drug, and after 6 months, stop the drug, hopefully is it going to come back? If it does, they will then say to the patient, we need to take your gland out.
Yes.
Or we need to give you radioactive iodine, which will be concentrated in the thyroid gland and destroy the gland. Then you will have an underactive thyroid gland for the rest of your life, and you'll have to take thyroid hormone replacement. And I think generally that is rushed into too much. I think that people should try and treat that problem more holistically. If they want to. I mean, some people don't. You know, they're not interested. They just want a quick fix. But those people who feel that they'd rather keep their own gland, which is producing their own thyroid hormone,
Yes.
can often get good results by using nutritional medicine.
We find that so many people, when it comes to the thyroid, they're not seeking second or third opinions.
Really?
And many times a doctor prescribes surgery and they go ahead and have it done, and that's the end of it.
Yes.
But I think that more people should consider having a second and or a third opinion.
Definitely.
Don't you
Yes.
think it's a good idea?
I do. I think, look, a lot of times in medicine, people panic. You know, you don't have to be a panic merchant. You just want to relax. It's not going to
Right.
kill you overnight. You know,
Right.
just chill out and go, well, okay, I'll listen to what the doctor said, but I'd rather check on a second opinion, a third opinion. Hey, it's your body. Take
Exactly.
time. It's
Sure.
more important than how much money you've got. It's your health.
Exactly.
Yeah, go and see a top specialist. Go and see 3 or 4 specialists. Check out on Dr. Google. Dr. Google's often got some fantastic information.
Well, there you go.
Yeah, or go
Cool.
and see a naturopathic medical doctor.
Sure.
Yeah, because a naturopathic medical doctor will understand that overactive thyroid or underactive thyroid is autoimmune, and they'll understand to treat your immune system, to improve your gut health, and to try some natural therapies. So, you know, what I would do in a patient who has an overactive thyroid, I would check, well, is it autoimmune? And that's determined if they have antibodies present that are attacking their gland.
Yes, yeah.
And we check if they've got the thyroid stimulating receptor antibodies, right? They're specific. So if they got the thyroid receptor stimulating antibodies, and don't forget, it's all in this little book here, Your Thyroid Problem Solved. If they're high, we know that it's their immune system attacking their gland and making their gland overproduce the thyroid hormone. So we want to get those antibodies down.
Exactly.
They're dangerous. They're like little missiles that are attacking your gland. We want to get them down. That's important.
And how long will that normally take, Dr. Cabot?
It can take several months, and they'll gradually come down. It might take, to completely get them down, several years. But you'll feel much better way before then. So how do we get them down? Well, you may need a detox. You know, if you've got a lot of gut inflammation or liver
Sure.
inflammation, that is going to make you more prone to autoimmune disease. So we may give you a detox, like the liver cleansing diet, or in my thyroid book, we do have a very good little detox. We'll check to see if you're gluten intolerant. We can do blood tests.
That's a great idea.
Yeah, and we can do a genetic test to see if you've got the gene for gluten intolerance. And if you are gluten intolerant, we'll take you off gluten. And that can make a big benefit on your immune system and improve the overactive thyroid or even the underactive thyroid. And it'll take about 6 months of a gluten-free diet to really see the benefit. So you've got to be patient there. The other thing that I would give in an overactive thyroid, I would give magnesium. Magnesium, the great relaxer, because people with an overactive thyroid are hyped up.
They are.
And indeed, an overactive thyroid condition can be brought on by stress. If you're highly stressed, you're working too hard, which I don't recommend, working too hard, pushing yourself and not able to relax, that can trigger an overactive thyroid. So magnesium, it's very important. It'll help you relax, calm down your nervous system, calm down the heart, calm your whole body. So get some magnesium into you. The other thing, to get your antibodies down, you will probably need to take selenium. Now, a lot of people say, well, how do I know if I need to take selenium? Because, you know, I need a blood test. But
Sure.
Unfortunately, a blood test is only going to show the tip of the iceberg. Most of your selenium is found deep inside your cells in your DNA, in your nucleus.
Yes.
So to really know your selenium, you need toenail clippings. to analyse tissue. So you can have your toenails analysed and that'll tell you what your selenium status is. But in anybody with an autoimmune disease, I would give selenium anyway, because if you use the right dose, it's very safe.
And how do you feel about hair analysis? Do you ever prescribe that?
You know, a hair analysis is a general guide, but you know, once again, it's not truly representative of selenium, because you know, the selenium is found in the DNA.
Yes.
And not all hair is a living tissue, is it? It's mainly the follicle that is living tissue. So, you know, I generally give selenium anyway, because I find it is therapeutic for people with autoimmune disease.
Right.
And I have seen it work very well and bring down antibodies. And there's research. There's research in medical journals to show that thyroid peroxidase antibodies can be reduced with a selenium supplement. So it has been tested clinically.
Wonderful.
So,
very good.
It's academic research, so I'm not the only one that believes in it or who has tested the theory. So selenium, for sure. Another thing, you know, Dr. Dan, that's very important for people with an overactive thyroid is to check their vitamin D level.
Excellent point.
Yeah, because, you know, vitamin D is a hormone, really.
Sure it
and
is.
it has a profound anti-inflammatory effect in our body. So if we have an autoimmune disease like thyroid disease, we've got too much inflammation in our body. We need a natural anti-inflammatory. Vitamin D is a wonderful natural anti-inflammatory. So have a blood test and make sure your vitamin D level is above average. You don't want to be average.
Exactly.
If you've got inflammation. You want it to be at the upper limit of normal, right?
And do you find that by taking the magnesium, this helps to bring things under control rapidly, or is it a slow process?
With an overactive thyroid, if it's very overactive, you'll need the drugs initially, as well as the supplements.
Okay.
So you can safely take Neomercazole medication to stop the overactive thyroid at the same time as taking magnesium and selenium and vitamin D, also omega-3 fats. They're anti-inflammatory. Do some raw juicing, and that'll work very well. And then long term, when you've improved a lot and you're coming off the drugs, the nutritional supplements are still being prescribed and they'll hold you. They'll keep you normal.
Wonderful.
Yeah.
Do we have any case histories that you could share with the audience?
Yes. I've had several women, mainly, because thyroid problems are far more common in women
Yes,
than
that's
men.
correct.
And particularly in younger women, overactive thyroid of the autoimmune type. So I had one lovely young lady who had a slight goiter, so her thyroid gland was slightly enlarged, and she had Graves' disease, Graves' disease means overactive thyroid of autoimmune type. Her antibodies were way too high, and she was on Neomercazole prescribed by another doctor, and she came to see me because the other doctor had said, look, we're going to have to irradiate your gland or take it out because the drug is not going to work long term. She'd been on it on and off for several years.
Okay.
And she didn't want to lose her thyroid. She was only a young woman in her early 20s.
I see.
I said, well, look, I think we can do this. We can save your thyroid. So I gave her natural progesterone. She had symptoms of progesterone deficiency, which is quite common in young women with an autoimmune thyroid disease.
Okay.
I gave her selenium. I gave her a gluten-free diet and vitamin D to bring down the antibodies. And I told her not to work so hard. She was way overworking. She was a nurse.
Oh, okay.
Very dedicated.
Makes sense.
And had a very stressful job and a boss that was pushing her too hard.
I see.
So she changed the job, and we gradually reduced the dose of the Neomercazole, and she's fine. She's maintained on supplements and a gluten-free diet and progesterone, and she didn't need to have her thyroid removed.
Well, that's a miracle right there in itself. To save the
Yeah.
thyroid, that's so very important.
Yes, it is, and you can do it. I mean, she was willing to have a healthy diet and go gluten-free and take the supplements, and I think most people are, if they can keep their body parts.
Well, sure, absolutely.
Yeah.
Yeah, once
Yeah.
the patient has sufficient motivation, either do this or have the thyroid taken out, well, they're going to be compliant.
Yes, and then I had another patient, a little bit older, a woman who had an overactive thyroid and was on drugs to control it. And she wasn't really feeling very well at all. And once again, she wanted to save her thyroid. She also had very bad gum disease, periodontal disease, which wasn't being treated. And she was also gluten intolerant. So I treated a gum disease, with good hygiene and gargling with colloidal silver. I gave her a detox, gave her natural progesterone, gave her selenium, vitamin D, the standard things to help reduce the antibodies that cause the overactive thyroid, and she responded beautifully. And she's doing very well. She didn't have to have her thyroid removed. So it's a pretty typical outcome, really, of women with an overactive thyroid. They can control it by using holistic medicine. And one thing also that we should mention is that natural progesterone can help these women who have an overactive thyroid. It has a calming effect on the thyroid.
Yes.
And magnesium, as we mentioned, is very helpful. And the other thing that I think is important for people to realise is that overactive thyroid is rarely caused by overdose of iodine. A lot of people think that iodine, or you guys say
iodine,
iodine or iodine, same thing, is a mineral, very important for human health. But there is a misconception that a common cause of overactive thyroid is taking too much iodine. Now, in someone with an overactive thyroid gland, we don't give iodine without checking first. We do a urine test.
Yes.
And if the iodine is low, deficient, they need some iodine. If they've got too much iodine in their body, obviously we'll avoid it.
Exactly.
But you need to evaluate what is the patient's iodine status with a urine test. You don't just run away from iodine. It's very, very important for thyroid health.
Yes,
and
indeed.
So, if people want more information, Dan, on overactive or underactive thyroid, my book, Your Thyroid Problem Solved, it covers over and under, and it's got a detox, and it teaches them about the benefit of selenium, wonderful mineral for the thyroid, and has been shown to have anti-cancer properties when it relates to the thyroid gland. Also, iodine, vitamin D, those are the things that can help to make the thyroid gland tissue healthy and reduce antibodies that damage the thyroid. And also go to liverdoctor.com, because we have some great specials there for people who are on a budget, who are wanting help with their thyroid, that is going to offer them a long-term solution.
Very good, Dr. Cabot. Thanks for being with us.